We are meeting today with Health Agent Lisa Cullity and Lieutenant Wendy LaPierre of the Pembroke Police Department to talk about COVID-19 in the town of Pembroke. If you have any questions during this forum, please email them to pembrokeinfo@pactv.org. That's pembrokeinfo@pactv.org. And Wendy, I know that you're going to have to hop off pretty quickly, so I'd like you to just give the folks an update from your standpoint, how Pembroke is doing overall during this crisis, especially now that we're back into the red.
Well, I think we can do a better job, but I think overall as a community, we're doing very well. We have had a couple of issues at the community, behind the community center when kids are off of school and at the basketball courts, but we've dispersed the gatherings and people have been generally taken it well and moved along. We just want to encourage people to continue with the wearing your masks and social distancing. We want this disease gone just as much as anybody else.
Absolutely. And how have the first responders been in terms of how many calls they've been getting, what they have to do a little bit more now than they had to do before? How are they doing? How's police and fire and first responders doing?
We're doing well. We have changed protocols, of course. Every time you see a police officer or firefighter, they're going to have a mask on. We don't send as many people into calls until we know exactly what's going on. And if we do believe that the person is COVID positive or has symptoms, they'll have full PPE on when they go into homes. But generally, everybody's, we're working together to get through this.
And I've noticed that people seem to be very, very aware of each other when they're passing each other in the supermarket or even in a hallway. People tend to give each other space, and you can tell that people can nod and smile with their eyes, which is really nice because basically we are all in this together. Have you found that there's a community sense that has come out of this?
I have, and I've noticed it as well, Julie, in CVS and Stop and Shop. People have been kind and they have, maintained the distance. And I think in the end, this will bring us all closer together. I can say that people have been super kind to us here. We get cards and all sorts of nice emails thanking us daily for the job that we're doing.
And lots of goodies. I notice on Facebook, you get a lot of goodies dropped off, which is wonderful.
We do, and we truly appreciate it.
That's wonderful. Now, voting is next Tuesday. So is there anything different about the protocols for voting than we usually do in the town of Pembroke?
So no, we're going to have an officer at each precinct, as we always have. The hours are 7 a.m. to 8 p.m. And we just hope that it's a quiet day. Everybody gets out to vote, but we don't anticipate any issues.
Right. And if there are any issues with, not necessarily in Pembroke, but maybe other towns, you do have a kind of a mutual aid agreement with other towns, correct?
We do. There are task force, and we are well prepared.
That's wonderful. That's excellent. Thank you. And whenever you have to hop off, go right ahead. Wendy, thank you so much for joining us today. If you could stay, that's great.
Thank you, lady.
Thank you. So Lisa, we're in the red right now. So let's just talk about what that means to the town of Pembroke. I know the website has a bevy of information. Our town website is loaded with information. And I'll just bring up this first page, which has the phased reopening halted in Pembroke. If we can bring that up.
Yes. So the town website has a lot of information on it, and it's going to redirect to a lot of different things. And the first thing that everyone should notice is on the COVID page of the town website. It's really helpful because it has the daily statistics, the case counts, all of those types of things. You're going to be able to see the case count updated daily. You can sign up for updates if you'd like them. And obviously, give or take, around October 24th, we started seeing an escalation of cases. Okay. If you trace it back, it really actually started around October 19th. Then we had some lower days, and then we had several days of higher count cases. So the COVID-19 website on the town's page is going to talk about whatever's going on in the town. First of all, that the phased reopening has halted, so we're not going to see more reopenings in more higher capacity areas. That's number one.
Yep.
Two, because as of yesterday, we will have triggered being in our third week of high risk. We're now not designated a low risk community anymore. And so we actually are going to be updating our guidance with what does that mean for businesses. The sector guidance that says we are going back to phase 3, steps 1 and 2 in case.
Yeah, and I have that up right now.
Phase 3, step 1.
Yeah, I have
Wonderful.
that. Yep. So you want to go through that?
Sure. So yeah, a lot of these are not going to be really specific to Pembroke, but I'm going to touch on them real quick because they will impact people's choices when they go elsewhere. Indoor theaters and performance venues would be closed. Outdoor gatherings are going to reduce from a 100-person limit to a 50-person limit. Outdoor theater and performance venues, they were allowed to be up to 50%. They would have to drop back to 25% if they're a high-risk community. Roller rinks, trampoline, obstacle courses, those would all be closed as the risks go up. Arcades and indoor recreation businesses would drop from a 50% capacity back to a 40% capacity. Driving and flight schools, again, from 50% to 40%. Gyms would drop from 50% to 40%. Libraries would drop from 50% to 40%. Museums, restaurants. Music is allowed indoors with the proper setback, 25 feet, but there would be no wind or brass instruments or singing, meaning you can't actually sing. You could have acoustical without words.
Right.
The fitting rooms would be allowed but limited.
Okay.
So things like that. So the overall impact is not going to be enormous. Party sizes reduced from 10 to 6.
Yeah.
Seating at bars where bars are a workstation would be removed from restaurants.
Okay. Speaking of our restaurants, and we want to keep supporting our restaurants, and you had a really good idea about holiday baskets that you were going to do. What do restaurants have to do, and what do we as patrons who want to continue to go to restaurants need to know now that we've been rolled back one phase?
I'll be honest, because of both my occupation and my husband's occupation, we are not comfortable dining in because of the risk we could pose to other patrons. So my husband and I have been making lots of use of al fresco dining, and we've been thoroughly enjoying it. We've been putting on our hoodies and everything else. So that's one way you can support them. 2, many restaurants are creatively using tents outside to increase their capacity, yet maintain social distancing, a lot of them with heaters and really fun decor. So take advantage of that. But then another way is we can go back to what we were doing. We can continue to support them with takeout. And one of my goals this year is to be 100% local in all my Christmas shopping. Anyone who's watched the news knows that Amazon and all those online retailers have made enough money. Matter of fact, they're going to have banner years this year. So I'm not shopping with Amazon or anything else delivered to my doorstep. Instead, I'm going to concentrate on giving a lot of my friends and family local gift certificates to local restaurants, knowing that they could certainly use the money. Also, don't forget about our craft brewery and craft wine industries. There is a winery in Pembroke, for those that don't know, up in Corporate Park, Artis. And there's several local breweries in our area. Of course, because of the COVID regulations, many of them have not been able to open at all. And when they have been able to open, it's been limited and it's inhibited their abilities. So I'm going to do a lot of gift baskets that are going to include great local brewery brews, micro brews, some gift certificates, some fun things like that.
Right.
Some wine for the wine lovers. It's a great way to give a really wonderful basket, but also support our local community.
Absolutely excellent. Talking about holidays and things that are coming up, is there any new guidance about people that are traveling in from other states or even other parts of our state, what the protocols are?
Sure. So the governor's updated the list, and you can find that on the state website. If you go to massachusetts.gov, there is a COVID banner, all things COVID. You can click on that, and then there's additional links in there about travel. There are very few states from which you can travel and come into Massachusetts and not quarantine. The quarantine is mandatory. You are allowed to have a negative test within 3 days of your travel into Massachusetts as well. So those two things would have to be complied with if you're traveling from out of state.
Can I ask a question on that?
Most of the New England states are exempt from that.
I'm
Sure.
sorry to interrupt you, but I know I personally had this happen to a number of people I know. They have people that come in from other parts of the country, and they want to get a test right away as soon as they come in, either the rapid test or the PCR test.
Sure.
They're having a problem getting the test because they don't have any symptoms. But they've
Correct.
traveled, so they want to get a test so that they can then go visit people. What do people do in
Correct.
that case?
So that's the challenge. You're asking any testing location in any state. Yeah, ideally, what would be the best thing to do, and what people are not having a challenge with, is scheduling their tests in advance. So presumably if you're going to travel for Thanksgiving, you're going to make some sort of travel plans.
Right.
If you call far enough ahead, scheduling a travel purpose COVID test is not a challenge. Obviously, any COVID testing location has to prioritize those that have been exposed and
Right.
those that are ill. And as more and more people are exposed, as the case count keeps climbing and climbing and climbing, obviously you can only test so many people at one time, so they have to deprioritize someone.
Right.
People testing for travel, of course, are going to be the people deprioritized. So my advice to people traveling for the holidays are test before you go. Know before you go is the nationwide cliche that goes along with that, and schedule the test wildly in advance. Now,
Right.
yes, you have to have your test within 3 or 4 days before you travel, but call ahead to make sure you book your time. Now, the other challenge people are going to see is a lot of people have already called and done this, so there are going to be a lot of, as we call walk-ins or open testing where there's no requirement to go get tested, are going to be picked up because people have made their travel plans in advance.
Right.
So then the next thing you can do is call ahead to your destination state and see if you can book something at one of those walk-ins on the quote unquote backside, and simply quarantine when you get there, test as soon as you can after arriving, and everything else. And the last option that everyone forgets about is everyone thinks quarantining means you can't be with your family. Well, no, you would quarantine with who you are going to visit. Now, obviously, if you're going to have 24 people over for Thanksgiving and you've just come in from a high risk area, that's not really responsible behavior, and you should rethink that. But if you're a college kid going home to be with mom and dad, that's where you would quarantine anyway. So it would just mean that college student, when going home to visit, friends and family for Thanksgiving, shouldn't be going out to the local pubs or anything else. Not that, strictly bars are open, but you know what I mean? Go out to restaurants and have a bunch of beers with friends.
Okay.
You shouldn't do that. That is one way that this virus will gain a lot of momentum and be spread a lot.
Now, there is a question, a lot of people are confused about the rapid test versus the longer test. And that the rapid test isn't really as accurate as it could be. Is there any guidance on that at all?
Actually, there is, and it's changing.
Okay.
Just in case we wanted to confuse the issue more. So the two types of tests are actually not rapid and non-rapid. The two types of tests are actually PCR tests, and that is the gold standard. That one is the best. That one has very few flaws or problems with it. The other test is an antigen test, not an antibody. A lot of people confuse the two. Antibody is looking for antibodies to see if you already had coronavirus.
Yep.
The antigen test, formerly or sometimes identified as the rapid test, is easier to determine at remote locations and get a rapid result. Now, to make things more confusing, many facilities have been able to rapidize or speed up their results for a PCR test. So a PCR test and an antigen test are no longer non-rapid and rapid. You can get a rapid PCR test. You can get a rapid antigen test.
Okay.
You can get an antigen test that doesn't always have immediate results because of whoever is taking the testing sample from you, their ability to process it, meaning their facility, their organization.
Okay.
So rapid and non-rapid no longer mean anything. You can get a rapid PCR. PCR is the best test. The problem with the antigen tests, formerly known as the rapid test, is a lot of false positives associated with that test. And in Pembroke, we have seen 2 cases with false negatives.
Okay.
We don't like to see that. And I know a lot of medical clinics are moving away from the antigen test due to its problems with reliability.
Okay. Let's talk about schools, because I know there's a lot of parents who are concerned with other towns, not us necessarily at all, but there's been other towns near us that have had to close down or alter their plans. Can you talk about what's going on in Pembroke?
Absolutely. So in Pembroke, we have not seen any case transference within our school system. As a matter of fact, we haven't even seen any case transference within our community. While on one hand, we look at the rising numbers and become alarmed going, where are all these cases coming from? What we haven't been able to do in Pembroke, and the state's seen no evidence of this either, because I called the state to ask about it, that these cases are related, meaning that these aren't people that all got together and had a party and now we have a bunch of positives. These are all isolated cases across very different age groups, very different socioeconomical groups, very different geography groups among the town. So we're not seeing transference within the town, but more importantly, we're not seeing transference within the schools. In other words, kids going to school that may have been sick are not making other kids sick. And I applaud the school administration. I applaud the teachers. I applaud the custodial staff that is doing just such an amazing job over there. The fact that all people are kept 6 feet apart except when transferring from classrooms at the higher levels. The fact that they are being so diligent about cleaning and mask wearing obviously is showing that we're not going to see a lot of transference within the schools. Now, what we have seen happen in other communities is a few different things. Some communities have had a little bit of transference issues in schools. Very, very few have had that issue. We don't know why. They're still trying to get to the bottom of it. That led to them closing schools for 2 weeks just to give everyone basically an isolation order so that kids aren't transferring it among themselves. We've seen other schools have to close because, unfortunately, of the choices made by the student body themselves, i.e. large parties, big gatherings, and that has forced a few schools to close because the people having these events know they're not supposed to have these events and do not tell contact tracing, the Board of Health, or anyone else who was at them and who might be there. So a community is left with no choice other than to close school and isolate everyone so that there's no possible chance for the virus to spread beyond the event itself.
Okay. Now, hockey, I know hockey rinks had to close. Is there any other sports that kind of surprised me because there's so many contact sports that you seem to be more close together than in hockey. But what is it about hockey that made the ice rinks close?
So the best information we have today that speaks to the, and it's not just hockey, it's ice rinks. Right. So the best information we have with the hockey issue itself is we had one organization that unfortunately made the choice to have a very large tournament that is in direct violation of the governor's order. We know that not every rink was being diligent about the protocols, such as locker room separation, locker room sanitization, separation of groups, social distancing on the bench, and that was a challenge. And we had certain teams and organizations that were not taking the guidance given to them seriously. When you put all these things together, I think the governor was forced into a corner of having no choice but to close down all ice rinks. I know that really upset a lot of people in the hockey community, and I know that they pointed to the statistics of there were only so many people positive. And they're right. Out of the total number of players, there weren't a lot of people positive, but statistically, the amount of positives in the people associated with going to and coming from ice rinks was significantly higher than the rest of the population, like 10 times higher. So you know you have a problem when you have an indice occurring at 10 times the rate of the regular community. Sure. Okay. So I think the governor was trying to send a message. I do know that another problem with the ice rinks were, unfortunately, clubs and organizations were not forthcoming with their rosters. In other words, we knew we had positive players on the ice. We knew they were on the ice with other players, and certain organizations refused to give a list of the individuals that might have been impacted. So again, just like having the party, for the high schoolers, this was the exact same problem. Basically, someone threw a big party on the ice, and we couldn't even know who had been there and who had been affected. So the governor had no choice but to close down all the ice rinks to stop the transfer.
Okay, so 2 weeks off. Yeah. Okay, Halloween.
Hopefully that's it. And I should be quick to say, Pembroke Youth Hockey did an amazing job and set the gold bar standard, so much so that several communities reached out to Pembroke. Pembroke required facial coverings on the ice all the time before any other organization. Pembroke Youth Hockey closed down locker room use. You had to come to the arena ready to go, so to speak, before anyone else, because they saw the issues and took immediate and significant action. And we've not had any issues with Pembroke Youth Hockey or their population, resulting in positives that were spreading throughout the community. So, hats off to them. And again, I hope that other organizations take a page from the book that hockey can be played safely. And I hope everyone takes note of that so we can get the kids back on the ice.
Absolutely. Again, if you have questions, please email them to pembrokeinfo@pactv.org. Lisa, Halloween is this Saturday night. Now, I know for people that cannot participate for one reason or another, just turn off your lights, your outside lights off, and that should be the signal that you don't particularly want people coming up to your door. It's not that you don't like Halloween. It could be because you have someone that's either compromised or an elderly person in your home. Is that correct?
Yes, so I don't know who started the rumor Halloween is canceled. Halloween is not canceled. No one ever talked about canceling Halloween. I think what people need to focus on is how do we do Halloween safely? And the first thing, as you brought up, when someone's lights are off, please respect that. You don't know what's going on behind that door. As you pointed out, it could be someone that's compromised. It could be someone that's higher risk.
Right.
It could be someone that's positive. You could be walking up to a house in quarantine. Please do not do that. For the obvious reason, you'd put you and your child at jeopardy.
Right.
And I think that brings us to an important point that this year, not that parents shouldn't be supervising their children every year, because they should, but this year it's going to be even more important for parents to supervise children. And maybe even if you have that older demographic of children, maybe you don't walk them door to door, but maybe you're at least out on the street while they walk around, at the top of the street, kind of keeping an eye on things, because safety is going to matter here. The other thing is you want to minimize your human contact. You don't want to have a large party this Halloween. That would probably be a choice that would put you and your family and whoever you invite at a much higher risk. But trick-or-treating itself, so long as you're not in a large group, is not dangerous. Obviously, you should wear your facial covering. I bet we're going to see some really creative masks this Halloween, and I look forward to that. The other thing is try to avoid hand-to-hand contact of candy for obvious reasons. Everyone's seen on the news the awesome candy slides that are out there, candy clotheslines, candy zip lines, for lack of a better term. Those are wonderful to use. I'm not that creative, so one thing I had for people is get out your tongs. Tongs have great uses beyond just cooking. You can maintain some distance from people by using tongs, and you can avoid handling the candy firsthand. I'm going to hold up. This is not one I'm handing out, so I don't want to contaminate it, but my other solution is I've put multiple assorted pieces of candy in Ziploc bags, and I'm going to be standing them up on a cookie sheet, and that way children can walk up and just touch the bag they want, just take that and walk away, so that avoids them reaching into a bowl of candy.
Right.
And it avoids them touching all the other candy or touching any candy that's been touched by the kids in front of it.
Yep.
And by having those bags all spread out on a table, they can just take one and go.
Yep.
That way I'm safe and they're safe and they can enjoy.
Okay, great. I know here in the town of Plymouth, where PACTV is headquartered, every day the town puts out the new cases and the ages and the sex of the person that has been tested positive. Do we do that in Pembroke?
Nope, we're just doing a case count. All of that information is tracked, but all that information is being tracked on the state database, which is known as Maven. We're keeping all that information on Maven. Pembroke, and I'm not saying other communities don't, but Pembroke takes people's privacy extraordinarily seriously. So we're avoiding doing anything that might put demographics out there that allow people to be identified with their personal medical data. And then another thing is, while some communities have the ability to compile these metrics, I would remind people that the staffing level at the Plymouth Board of Health is not in line with the staffing level at the Pembroke Board of Health. Keep in mind that on top of trying to manage this pandemic, I still am a full-time health agent doing Title V work, other work, and inspections. So some of these demographics are just not easily broken down.
I think the reason that I asked was because there's been, especially the governor has said, it's the 18 to 40 is the age group that seems to really be blooming in the positive cases. That would be good to know, would it not, as a town resident?
Yes, and we've said that age group is definitely on the rise, where we saw next to no one in that age group in the beginning of the pandemic, and we're definitely seeing a lot of that age group in this aspect of the pandemic. And I would steer people back to the statewide website, and I'm going to explain why. While it's nice to know your community's makeup or demographic, I'll point out the obvious: people don't just stay in Pembroke. Plymouth people don't just stay in Plymouth. So when you hyper-focus, I'll call it, on a community's demographic, that number doesn't really mean anything if people are moving in and out of the community. Right. And I think the largest thing you're seeing in that demographic is that these people, while their case counts come back to their hometown, you have a whole lot of college students, high school students that are going places. They're not becoming infected within their home community, but when they become a positive case, that positive case number and information comes back to their hometown where they're registered to vote usually. So some of that demographic is a little bit misleading. So again, when you get hyper focused on a community statistics, that only works if the community is kind of isolated or bubbled. And I don't think that's the case. I think the vast majority of people and I'll take it outside of Pembroke, but Plymouth, Kingston, they don't work in their same community. Right.
So if I can just bring this up, control room, if we can just bring this up for one sec. This is the dashboard that you can go to on the mass.gov website, and it literally has everything, and it's updated daily. The table of contents shows you the testing and where hospitalizations and deaths and it has everything, and it's updated every single day. And it's a wonderful vehicle to really find out up-to-date information. So it's mass.gov, and then it's called Daily Dashboard. Back to you, Miss Lisa.
And the advantage, yeah, no, and the advantage of that, and thank you for showing that to all of our viewers. The advantage of that is not a lot of people go in and out of Massachusetts every day. Yes, I know there's people that come here that work here that live in Rhode Island or live in New Hampshire. But what I'm talking about is that dashboard being a better indicator for Massachusetts because the majority of people live and work here. So it gives a better overall, picture of the community, so to speak.
Mm-hmm. And to close up today, let's just talk about the next couple of months, where there's going to be travel,
Yes.
There's going to be kids coming back from college, there's going to be gatherings, there are, of families and maybe friends also. If people continue to social distance, if they always wear their masks, if they practice good hygiene, always wash their hands, it's pretty much known at this point that can really mitigate the chances of spreading the virus. Is that correct?
Yes, it is. And I hope that I don't want to ruin anyone's Thanksgiving, but I'm going to take a grain of salt from the governor. Everyone has to think about their own risk tolerance. And I think that's the biggest problem that's happening with the coronavirus is everyone's risk tolerance or willingness to take risk is different. And what I think you're seeing clash on social media, even throughout politics and such, is people with a much higher threshold for risk get angry at the people with a very low tolerance for risk and vice versa. And everyone has to acknowledge that everyone has a different risk level, but I want everyone to acknowledge that your risk level has impact not just on yourself, but everyone around you.
Right.
And then it goes out like ripples in a pond from there. So as you're planning your Thanksgiving festivities, do try to socially distance, do be outside if you can. If you have to have a large number of people, spread out as much as you can. If you have people traveling in from out of state, try to get your corona tests. If you have kids, I know a lot of colleges are doing a lot of testing. So take advantage of that, kids, before you come home, because no one wants to come home and bring something to a higher risk family member. My personal Thanksgiving is going to be 4 people. Mm-hmm. Sorry.
Yep.
Both my husband and I, due to our occupations, are forced into a position of being more exposed to people than a lot of people would be comfortable with. So yep. I'm not going to take it beyond that. I'm going to take advantage of all the space in my house to provide a lot of space between me and my mother. She's very important to me. She is in the high risk category. Yep. So I'm just not comfortable increasing that risk by having more and more people over. If you are hosting, do sanitize, do spread out when you can. And consider limiting the guest list if you're comfortable with that. Consider using great things now. See, I have family over in England, so I've always been into the Zoom or the phone call, like even before Zoom was a thing, FaceTime, so that we could, share a little bit of the holidays. So be sure to make use of things like that too.
Yep. And everybody can open their windows in their house every once in a while, let some fresh air in, even if it's cold, for a few minutes. I know we do that here at our office. We open our front and back door and let the air just go through, because in a lot of office buildings, the windows don't open. So you have to rely on your HVAC, which we have the filters changed constantly, and we have professionally people come and do disinfectant, and we disinfect every single day. And we have never closed. We've been open since day one, since March, when things
I remember
went south. Yeah. So, and we want to continue to be able to do that. And any information that we need to bring to you from the town of Pembroke, at any time you can call a emergency forum or anything else, and we'll be glad to pass this information on. So, Lisa, people will go to the website to get updates.
Yes.
Also, the social media. Town of Pembroke has its own Facebook, Twitter, etc. If you want to see this forum again, you can go to pactv.org/Pembroke for replays. And any closing words, health agent Lisa Cullity, for our people of Pembroke?
I do. Everyone talks about how this experience is infecting them, and there's no doubt that it's affecting the population in a very negative way. I want to ask everyone, right before you get on social media or get into an argument with someone at the supermarket or anything else, whether your view is you should be wearing a mask or gloves or whatever else you think versus this whole mask wearing thing is stupid, I'm going to talk to all of those people right now. Just stop for a minute. Everyone's comfort and risk level with this disease is different, and certainly fighting amongst ourselves with each other does not help anybody. It does not make the situation better. It does not make the people that are afraid less afraid. It does not make the people that don't care and aren't afraid any more afraid. So just stop attacking each other, start supporting each other, be patient with people with different views. Don't get into arguments online, because I've never seen one person in an argument online that said, oh, you're right, I'm going to change my mind now, because it just doesn't happen. So let it go. Try to be supportive, try to be understanding, try to be patient with other people, let people make their own decisions, and certainly things like that. Leave things like enforcement to me and the law enforcement people. That's what we do. And just try to be a little more patient and kind, because I think if everyone could be just a little bit more patient and kind, we wouldn't all feel quite as COVID fatigued, and we could worry about the real enemy, which is a disease, and we could worry about the real goal, which is making sure everyone's here next holiday season.
That's right. Thank you. Appreciate that, and I feel the same way. Thank you, Lisa Cullity. This has been a COVID-19 update for the town of Pembroke. I'm Julie Thompson from PACTV. Thank you and good day.